Hello everyone, I am Dr. Kritishree. I have done my Masters in Psychiatry with a degree of MD Psychiatry and I am working as Consultant Psychiatrist in KMC Hospital, Mangalore. No, intrusive thoughts are not a sign of mental illness. It is very common for healthy individuals to have intrusive thoughts. In our brain, we have a thought center. A rational set of thoughts gets produced. That is, whenever we are in a situation, it produces equal amount of positive and negative thoughts, which is based on the experiences what we have and the exposure what we have got or the memory. This helps us in decision making. So as the situation goes away, these thoughts, intrusive thoughts also will fade away. But if it becomes repetitive, intrusive, irrational, as what we see in conditions like depression, anxiety, OCD, PTSD, then it is considered pathological. Intrusive thoughts are seen in both OCD as well as anxiety disorder. However, the pattern of intrusive thoughts, what we see in these two different illnesses are different. In case of obsessive-compulsive disorder, the intrusive thoughts are called as obsessions are irrational, repetitive, continuous and persistent, and it is ego-syntonic kind of a thought, which an individual knows that it is his own set of thoughts, but they are very silly. They can come in the form of thoughts, emotions, images and so on. So these thoughts, what they usually do is they result in compulsions. It compels the person to carry out certain actions. Either like ignoring the obsessions also can provoke anxiety in the patient, or ignoring the compulsions also can provoke anxiety. Coming to intrusive thoughts, what we see in anxiety disorder, here it is related to real life situations, something like impending doom, social failures, health related concerns. Here in anxiety disorder, these intrusive thoughts, they result in a set of physical discomfort like palpitations, breathlessness, abdominal discomfort, dizziness and so on. Mindfulness exercises or mindfulness techniques are quietly sitting and breathing and observing the bodily sensations. Meanwhile, gently shifting the attention from these intrusive thoughts into the changes what is happening in your body. Through this process, patients are taught to treat thoughts as passing events or floating clouds or the waves which are hitting them when they are standing in front of the shore. As a result of which, the intensity of these thoughts will reduce. The person becomes a non-judgmental observer and hence reducing the emotional grip on these intrusive thoughts. Some of the strategies, mindfulness techniques, where like you quietly sit and breathe and shift your attention into the breathing and the bodily sensation rather than on the thoughts. Next is catching these thoughts and labeling them. When these thoughts suddenly hover around you, tell it to yourself that now you are ruminating and these thoughts are intrusive thoughts. Hence, you are able to separate a logical thought from the irrational, illogical thoughts. Next is providing a 5-minute window where you can dwell through the thoughts and quietly and consciously come out of them. Then challenging these thoughts, always question yourself, or is it helpful in thinking in such a way or spending such a long hours in thinking in such a way. Question yourself so that it can help you to rationalize and come out of it. Next, what you can do is distract yourself. That is some things like exercising, journaling or talking to people and helping to understand the real situation. Lastly, some of the grounding techniques. Grounding techniques called as 5, 4, 3, 2, 1. What he can smell and one thing what he can taste. This activates the senses and grounds the patient to the present situation. When this intrusive thought becomes persistent, irrational, and when it starts affecting the socio-functioning ability of the person, then it is important to seek professional help.